this is the first hospital to be built after the COVID pandemic. So the lessons of the COVID, the 3.5 years of having to fight COVID were not lost to the Woodlands planning team. And they understood, therefore, the need for the hospital to be resilient in the provision of basic healthcare services in peacetime, and at the same time being able to scale and respond to contingencies, outbreaks, pandemics of the future, any healthcare emergencies that may occur. Some of which can be prepared for, some of which will be wild cards that may occur, and therefore to create that level of resiliency and flexibility to deal with this were important elements of that were part of the design. In dealing with pandemic preparedness, Woodlands has designed a hospital that allows for separation of areas dealing with infected patients, potentially infected patients, and not, as part of that pandemic resiliency. It's created ways in which it could scale up its hospital bed capacity and allow for it to be able to respond to needs on the ground, dealing with more patients coming in as a result of either mass casualties or infectious disease outbreaks, the way we had to deal with during the COVID years.